And a young woman whose letter I read on TV the other day, 23 years old, she died in January. Her mother wrote that when she graduated from college, she was thrown off her father's policy. And she was diabetic and insulin dependent, and so she tried to find a job. She couldn't get a job that provided health insurance. Not even enough money did she make to cover her medical expenses. So she started, and her mother had 5 children, a single mom, could help her only to a certain extent. So she started to cut back on her insulin, not taking the night dosage, and one morning in January, she just didn't wake up. That's over. That's over, according to the study. Under this legislation, children, if their parents agree, and they agree, can stay on their parents' policies until they are 26 years old, to give them a start, a running start out of college. But you name it, so many families in America have a person in the family with a pre-existing condition. And that, again, they are then denied access to quality, affordable health care. That is coming to an end. So no longer can they deny you for pre-existing. No longer can they say, you paid for your health insurance all along. Now that you're sick, we're canceling your policy. No longer can they rescind your policy when you're practically on the way to the operating room and say, we found out that you smoked when you were a teenager and you didn't tell us that, so that was a pre-existing condition. The insurance companies have totally gotten out of hand. But this... So it's really important in this legislation to expand access to many more people. 32 million more people will have 32 million more people will have access to health care. It will be affordable to the middle class, which is important because accessibility has to have affordability with it, or else who can afford it? So accessibility for many more people, affordability for the middle class, accountability for the insurance company. Never again can they come between the doctor and their patient. Very important. We've been playing on their turf for over 6 decades. It's time for the insurance companies to be playing on the turf of the consumer and the American people. The list goes on about what happens there. Primary care doctors to be paid on a par as Medicaid doctors on a par with Medicare doctors, so many primary care doctors will minister to those in the community health center. Vast expansion of access to community health centers, which are the first line of defense in some of our communities for meeting the needs of people, and we're very excited. But Jim Clyburn, our whip, had this as a priority. And more about health care, which you probably think I'm going to take all day to tell you about, but we're so proud of it. But what I want you also to know is that in this legislation, thanks to the leadership of Congressman George Millett, Chairman George Millett, Chairman of the Education Committee, there is a massive education piece, which President Obama will talk about on Tuesday when he signs the final version of the bill. And in that, we have an increase in what people who need Pell Grants can receive. So expansion of Pell Grants. Many more people, a bigger grant. We will have reduction of interest for student loans. We'll have direct lending for kids who want to go to college and need loans. But now we've taken away the middleman, take the money away from the banks, reduce the interest to the student, save money for the taxpayer. Much more funding for our community colleges, where our kids can go for apprenticeships, job training, and all the rest. Community colleges fare very well in the legislation. And something that I'm particularly proud of, because I've been working on it for years in the Appropriations Committee too, and that is $2.5 billion for minority-serving institutions, historical black colleges, Hispanic serving institutions, black serving institutions, our tribal colleges for Native Americans, to bring many more resources to these colleges so that they can in turn compete for grants. They can in turn compete for grants. That's wonderful. So, you know, Cecil and Jan have taught us over the years that every person, and the Bible tells us so. We talked about our own founders and their vows of life, liberty, and pursuit of happiness, and that we're all created equal. But the Bible has told us that for thousands of years. And Jan and Cecil, should I be calling you Reverend Williams? Cecil have also, this whole place, God Memorial, is predicated on the idea that there's a spark of divinity in every person, that we're all God's children. And that we, therefore, are all worthy of respect. Are all worthy of respect. But that spark of divinity also gives us a responsibility, especially if God has given us the opportunity to serve, to be public servants in the Congress of the United States, in the state legislature, in the Board of Supervisors, wherever it happens to be, that we have to say, not only do they have the spark of divinity and I must respect them, I have it too, and it carries a responsibility for me to do God's work. On a number of occasions, when I have spoken at celebrations and tributes for God Memorial, we've talked about the Gospel of Matthew, and when I was hungry, you gave me, it goes on, and the Samaritan, the Good Samaritan, who stopped to help somebody that he never knew, a stranger, helping someone else, not a neighbor, but a stranger.
Yes, it's preaching.